Seasonal depression is a subtype of depression, so it's actually not an issue of its own. Seasonal depression starts typically in the fall or winter and may go until the spring. But like any other depression, it looks very similar symptom-wise. When we look at seasonal depression, we're really looking at light and darkness. So in the winter, we know there tends to be a lot less light. The sun goes down sooner. So a lot of us can feel down for a day or two, and generally that's very normal. But it becomes more of a depression when we look at how long a lot of the symptoms are going on for, which is usually at least 2 weeks or longer. And then how significant or how impactful those symptoms are. So a lot of times, if you are not getting up for work, if you're calling out of work, if your sleep is off, low concentration or poor concentration, low energy, things you normally like to do, you don't want to do them anymore. Many times that's a big sign that something may be off. Prevention is always very important with any mental health issue, and when we talk about depression, we do talk about what are the things that keep your mood stable. We want to help patients in different ways to do that. Biologically, we talk about maintaining a good sleep schedule. Go to sleep at the same time, wake up at the same time. Don't have a lot of blue light an hour before bed. So really getting off of the cell phone or flipping through Facebook, things like that. We tend to stay at home a lot. We do want to try to push through that resistance that we get when there's colder weather. Part of it is planning ahead on what things can you do to have you stay connected with the people around you. We tend to overeat a little bit in the winter as well. A lot of us have experienced gaining a few pounds, so addressing our food intake, what we're eating, trying to limit carbs or a lot of sugary foods. There are a handful of things we can do even outside of improving our lifestyle or having a healthy lifestyle. So light therapy is a very good treatment for that. If you go on any major website, Amazon, Walmart, Target, and search for SAD light or light therapy, there will definitely be many options for you. And usually that entails you sitting in front of the lamp for anywhere from 20 to 30 minutes to really mimic sunlight. I think a big thing that not a lot of people know about is that a lot of people wait a long time to seek treatment. And anybody invested as a professional, we want people to come in, we want people to get help. So the goal is really to educate yourself about what may be going on and really talk to somebody about it and seek the appropriate care for it.